After months of controversy and weeks of scrutiny, Florida Surgeon General nominee Joseph Ladapo was confirmed by the state Senate this week in a contentious hearing.
Conspiracy theories and political rhetoric over widely accepted public health practices and science.
In the middle of a pandemic, Dr. Ladapo said not one word about COVID, about vaccines.
And we can't have the third largest state in the country's top doctor being a yes man to a politician.
After that, in his first one-on-one interview, it's with us. Dr. Ladapo pushes back on critics, defends his data and his decisions when we sat down to talk with him in Tallahassee this week.
I think it was Senator Farmer who said, they called your last 6 months an unmitigated disaster.
I remember hearing that.
How do you hear that? What were you thinking?
I think that for me, politics is new. And I've learned a lot. I've received a very rapid
Crash course
education over the past few months. So, do I enjoy people not saying very nice things about me? No, I don't, enjoy that. Do people have a right to have their opinions? Absolutely. And is my role here something that's going to change in terms of my priorities because someone doesn't like me or thinks that I'm the worst person ever, and didn't even go to school and have no education and training? No, that's not going to change.
I think it was Senator Pizzo who said, the optics are, not verbatim, but I remember, he says the optics are that you are a yes man to the governor. Do you remember him saying that?
Yes, I do.
Are you?
Well, I like Governor DeSantis quite a lot. I really admire him. I have great admiration for him, and I'm very grateful that he's here because no one else around the country, there's not been any other leader that's had such clarity during a period of time where there's been so much confusion and, in fact, mass confusion.
Okay,
so,
the question is...
Oh, I'm getting,
okay.
I'm getting there. So I very much like him. Yes, man. No, I'm not. I think I wouldn't even be where I am right now if I'm a yes man. In fact, I've taken positions based on what I thought was the truth or more accurate than what what my colleagues were often saying. And it's not been, that hasn't been a free ride. I'm not really sure what to make of it. Between the politics and, I just don't know what's sincere, what's not. And of course, people are welcome to have their opinions. The one piece that I've not been fond of is when people make stuff up. So I didn't like it when people said that I didn't take care of patients with COVID, because it's factually incorrect. I took care of patients with COVID, and then so that bothered me because it's factually incorrect.
Same thing with he has no experience in this and that, and trying people sort of recreating who I am.
You are the governor's appointee. He appointed you for a reason. He agrees with what you're about.
Yeah.
You agree with what he's about. Would you be comfortable if he came to you and said, Dr. Ladapo, I'd like our administration to go in this direction? Would you be comfortable if you opposed his ideas, telling him so?
Oh, totally, absolutely. And in fact, if I don't see an issue the same way as the governor, I would definitely tell him. I love the guy. I really, really, really like him. I very much like him and very much admire him. But I won't, for any reason, compromise what I believe to be true or accurate or representative of scientific data.
So you, during your confirmation hearings, they asked you some pretty pointed questions. Do you think vaccinations are effective? They accused you of not answering those questions. Are vaccinations for COVID effective?
So we are running into the same problem that I ran into that day, which is that there's been the political aspect of this pandemic has made it hard to separate something that is a scientific question, which is how effective is whatever medication or whatever therapy for a specific outcome, from this idea that does this work? Does this work is really a political question. The scientific question is about is about specific clinical outcomes.
Okay, so is the question, would my better question be, Dr. Ladapo, here's my medical background, here's who I am, here's my charts, would a vaccination work for me? Is that the question?
That's actually really great clinical questions. That's the kind of question that a patient would ask me. At a hearing, I felt a need to be very precise about the words I used. So, basically what I said then is what's been supported by the scientific literature, which is that, like natural immunity, they are effective at reducing the likelihood that someone becomes severely ill from COVID-19.
If that's the case, why not do much more to promote vaccines among those who have been vaccine hesitant?
That's a good question. So I think that one of the things that we've lost sight of during this pandemic, and really far in the rearview mirror, is choice. And this has actually been a cornerstone of public health. What we've seen instead is coercion, and there's been plenty of coercion. The sort of becoming a part of kind of this voice that wants to keep telling people that such and such works, and therefore you have to take it, and therefore I'm justified in denying you employment, or denying you access to eating in a restaurant, or denying you education because this works. I think that's immoral, and I'm just not ever going to be a part of that.
So your office put out a whole new set of PSAs that changed what was a very vaccine-oriented PSA messaging campaign to a much more holistic, choices on the table kind of messaging. Was that by design, and why?
It was by design, and it's because they're a component of health, but they're not all there is to health. I mean, think about the fact that we've had 2 years now, and how often have people like Dr. Fauci said anything about other things that are enormous contributors to health? So things like obesity, that's a very substantial contributor to how well your immune system works. That's really important, and it's important for other things like cancer and heart disease. So holistic health is absolutely the message.
How much pressure do you feel like you are under, if any, to match the politics and be politically correct?
I don't feel much pressure. I mean, I feel a little bit of pressure. Some things are just abjectly political. For example, the monoclonal antibody dispute that we had with the federal government.
Where are we in that supply chain issue now?
Well, we do have still monoclonals that are coming to Florida. We've got to work with the federal government to get them here. And
how is that working with the federal government? Really?
It's fine. It's fine.
You presented yourself as a doctor who challenges the narrative, who's not going to go along with what everyone else says. You're a researcher, and people have used that against you. What do you think about that?
I don't know. I think I'm not sure really what to make of that. And it's not so much, I don't set out to challenge the narrative. I've just set out to be as honest as possible. And we've truly had just a lack of dishonesty. And the masks are a great example. A lack of honesty. And the masks are a great example. It's not a coincidence that we haven't recommended them before in bad flu seasons. We've tested them. There have been many, many, many clinical trials, and most of them don't really show a benefit, and that's just the truth. So this 180-degree shift that hey, if everyone wears these, the pandemic will be over and you'll be protected. I mean, that's abjectly in conflict with what the scientific literature shows.
What about everything else health related in Florida?
Yeah, we have fun initiatives that are targeting all of those areas that you mentioned. They're sort of still in the works, so I don't want to reveal too much, but we actually have we have some initiatives related to the opioid crisis to better connect people who are addicted to treatment. We have some new initiatives related to smoking cessation to really amplify the use of our evidence-based smoking cessation resources. And we have a really fun initiative we're working on related to obesity. So that's in development, and I can't wait for it to become public.